Are you ready for a little anatomy lesson? First, I'm going to talk about your neck. So this is a model which shows your skull and the back of your neck here, and then the front of your neck here. So we're looking at this area here is right where your skull meets your neck, about right here. And as you can see, there's these teeny tiny muscles right at the base of the skull, and also a bunch of teeny tiny muscles as you go down your spine. These are the muscles that we're trying to target with the knuckle. When you place the knuckle in using the different widths, you're accessing different muscles. For example, you're seeing these guys with this tip. If you get a little closer to the spine, you're getting to those center muscles right there. And if you use these tips that are further apart, you're getting to these ones that are more towards the outside here. So this is the magic of the knuckle, being able to access these muscles. Now, these muscles here at the base of the skull get tight when we have that forward posture, that tech neck, right? Because then it shortens in here, and those muscles have to actually turn on every time we jut our chin forward to look at our computer screen, every time we look down to read a book or check our phones. Those muscles are getting tight, and that's primarily responsible for affecting our nervous system. If there's tension there at the base of the skull, then that is going to press on not just our brain and our spinal cord, but our brain stem, which is responsible for our sense of safety and all of our essential functions, including our digestion, our ability to breathe and take a deep breath. A lot happens when there's tension here at the base of the skull. So nearly every single human being on this planet needs to work on this muscle because it is so tight in so many people and so clearly connected to the brain, the spinal cord, and the brain stem, which is basically controls our entire body. Now, when you have tension here, you almost always also have tension in the front of your chest, because when we tend to go forward with our necks, we tend to round our shoulders forward here. So imagine, sitting in front of a computer, looking down, slouching, looking at your phone, maybe even like reaching out in front of you or chopping vegetables, for example. This rounded shoulder posture is going to create tension here in your pec minor. I'm going to show you a picture here of what pec minor looks like. So that muscle attaches to the front of your body, and it can actually cause this referral pattern that you see here, which is a trigger point. So if you're experiencing symptoms like that, that's where that trigger point typically refers to. I'm going to show you that muscle too here on this little skeleton. Obviously, this is the front of your body and your rib cage. Your pec minor attaches right here to the front of your shoulder blade bone. Kind of a weird little spot that sticks out there, and then attaches to those ribs like I showed in that picture. So it's about like this. So when you're searching for that muscle, you're looking right underneath your clavicle or your collarbone for a muscle that's going at an angle. It's kind of smallish right here. That's the muscle that's rounding your shoulders forward and pulling you forward in this position. And when you release tension in that muscle, that allows your shoulders to be in a better position, makes it easier for you to maintain good posture, which then allows your neck to be aligned on the rest of your spine, which then allows those muscles at the base of your skull and the rest of your neck muscles to finally relax. So this is important to address in conjunction with those muscles at the base of the skull that we just talked about, because both of those are key to being able to have good posture in the first place. If you have tension in those muscles, it's going to be very hard for you to maintain good posture. After you've released those two muscles, then you can start looking at the muscle that everyone wants to work on, which is your upper trapezius muscle. It's this muscle that when people say, oh, my shoulder hurts, this is big fat muscle that's right here at the top of our shoulders that has knots also in nearly everyone because of this postural thing. You can do this little exercise yourself where if you have rounded shoulders and your head is forward and you go touch that muscle, you'll notice that it's nice and tight and it's not relaxed. But then if you sit up nice and tall, raise your chest up, get your head on top of the rest of your body, that muscle relaxes instantly. So knots in this upper trap muscle develop as a result of the pec minor and the base of the skull being tight, which is why you need to address these two areas first and make sure that they're nice and relaxed before you expect the upper trap to ever relax. This muscle is also responsible for a lot of headaches. You can see here in this picture, these are all pictures of the upper trapezius, middle trapezius, and lower trapezius muscles. And you can see those red dots are the areas that it will refer pain when it's a trigger point. So this is one of the most common muscles that's responsible for headaches, along with those muscles at the base of the skull that we were talking about. So I hope this helps you understand a little bit about why we're addressing the muscles in the order that we are and why these muscles are so important for everything. When you have tension in these muscles, not only can it produce direct symptoms like in your neck or your shoulders, headaches, but it can refer pain other places. So maybe you're having headache pain, maybe you're having pain down your arm, maybe you're having rotator cuff pain, which is all a result of the pec minor being tight and not being able to reach forward without pinching your shoulder. All of these things are more symptoms that are related to muscle tension that is affecting your ability to align your body properly and use your body in the way that it was intended.